I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Today I'm going to talk about gout. So, what is gout? Gout is a common form of arthritis which is very painful. It affects usually one joint, that is a big toe. There are times when symptoms get worse, known as flares up, and sometimes when there are no symptoms, known as remission. Repeated attacks lead to gouty arthritis. There is no cure, but you can manage gout very effectively. So, what are the common signs and symptoms of gout? Gout flares up suddenly, lasts for few days, sometimes a few weeks. Periods of remission last sometime for years even. Usually one joint, as I said earlier, is affected. Along with the big toe, joints that are commonly affected are toe joints, other toe joints, the ankle, and the knee. Pain is usually very severe and intense. So the affected joint is swollen, red, hot. So what causes gout? Gout is caused by hyperuricemia, that means raised uric acid level in the body. Our body makes uric acid levels from purines which are present in the food. Too much uric acid in the body accumulates in the joints. So after that, the gout sign and symptoms appear. Raised uric acid level also makes kidney stones, and these stones sometimes block ureters. That's why it leads to kidney failure. If hyperuricemia is present in someone, but there are no signs and symptoms, so we don't need to treat hyperuricemia or raised uric acid level in the body. It is estimated that approximately 4% Americans are affected by gout. So being male is a risk factor. Females usually suffer after the menopause with gout. If someone is obese, that is also a risk factor. Having certain health conditions, for example, hypertension, diabetes, metabolic syndrome, heart failure, insulin resistance, or if the kidney functions are not normal. If someone is taking diuretics, for example, water pills, so that person is also risk of suffering with gout. Drinking too much alcohol, and if someone eats a food which is rich in purines, for example, red meat, organ meat, sardine, tuna, trout, so these people are also at risk of suffering with gout. So how do we diagnose gout? First of all, history is very important. After that, your doctor, a rheumatologist, will examine you. X-ray will be done. Blood samples will be taken and sent to the lab to check the level of uric acid. If the joint is swollen, red and hot, or the gout has flared up, then your doctor will take the joint fluid, aspirate the joint fluid, and that joint fluid will be sent to the laboratory to check the presence of uric acid crystals. If uric acid crystals are present, so that means that person has got gout. So the management is very important in the gout because gout disturbs normal daily life. It affects persons, for example, work and other activities. It can be managed effectively by yourself as well as your doctor. So how do we manage the flare up of the gout? Take non-steroidal anti-inflammatory drugs, for example, ibuprofen. If your doctor thinks that it's a time to give steroids to control this flare up. So the steroids will be given, or colchicine. Make changes in your diet and lifestyle, such as lose weight, limit alcohol, eat less purine food, for example, red meat, organ meat. So these changes will help to prevent future attacks. If you are taking any medication, for example water pills, so please speak with the doctor and choose some alternatives, because it is also very important to lower uric acid in your body, because uric acid also forms kidney stones. A few medications are used to lower uric acid level in the body. For example, allopurinol, febuxostat, pegloticase. Improve your lifestyle, eat healthy food, lose weight, protect your joints, and know how to manage the flare-ups of the gout. Thank you very much for watching this video. If you have any question, please write down in the comment section. I will answer. Thank you.